Good morning, everybody. It is indeed a matter of great opportunity to be amongst you. My previous speaker has spoken about the morality of the Indian Army, and he has inspired us. And now I am told to talk when you are celebrating the Festival of Bharat about healthcare and about the initiatives taken by the Government of India, Ministry of Health and Family Welfare, and other ministries also. Friends, in the past 4 years, and 4.5 years, under the dynamic leadership of Prime Minister Shri Narendra Modi ji, health has taken a big leap, and there has been a paradigm shift. If we see the health before 2014-15, we will find that the health was being addressed in bits and pieces. It was a disease-specific policies were being formulated. Once we had chicken pox, once we had smallpox, once we had little leprosy coming up, once we had tuberculosis coming up. And we designed programs for diseases. So it was curative and it was disease-specific. But it was not comprehensive. And it was not holistic. We tried to address issues when the issues came up. And it was being addressed in their own ways by the technocrats, by the top people addressing who were the experts of that disease. It is in 2017 that after due deliberations of 2.5 years, we came out with the health policy known as Health Policy of 2017. And this health policy is comprehensive, holistic in nature, taking all stakeholders on board, trying to understand the complications of it, and it is preventive, promotive, and curative. So the paradigm shift is from curative, we have focused on preventive and promotive healthcare. And it is a comprehensive healthcare which we have taken. The another thing which we decided was that it will be mainstreaming of all pathies. There is a problem, allopathy does not recognize Ayurveda, Ayurveda does not recognize Yoga, Yoga does not recognize Unani, Unani does not recognize Siddha. We said that we should mainstream all the pathies. And mainstreaming means documentation of how which disease can be cured by which pathy. So we started a program called as cross-referrals. An Ayurveda doctor can refer to an allopathic doctor. The allopathic doctor can send to an Ayurvedic doctor, so cross-referrals. And co-sharing. That means in the same institution, we'll be having all pathies together. And that is why you'll find that now in the coming up All India Institute of Medical Sciences, you have an Ayush block, where patients are referred from Ayush to allopathy, and allopathy patients are being. We have started a program called a Center for Integrated Medicine, where we are trying to document how a patient who is suffering from cancer and undergoing a chemotherapy, and his immune system is going down, which cannot be taken care by allopathy, but it can be taken care by Ayurveda. So altogether, how we can make the patient better. So this is called mainstreaming of all pathies. The third thing was the finance. As I say, that 5 senses don't work without the 6 senses. So we committed ourselves that we will increase the budget in coming times to 2.5 of the GDP. And also, we tried to see to it that there will be a strategic engagement of the private sector, where we are less, we can't afford, we are not able to give services. A private sector is there, we will strategically engage him. We will pay for it, but we will see to it that he gets the benefit. The patient should get the benefit. So these were the major 2017 policy which was enunciated. And when this was enunciated, we came out with a program which is much talked about now, which is known as Modi Care, which is known as Ayushman Bharat, which is known as PMJ. This has got two pillars. One is the preventive, promotive healthcare, and the another is curative healthcare. When I talk about preventive and promotive healthcare, we have taken a very, very bold decision that all sub-centers, which is the first unit of healthcare, and all the PHCs, primary health centers, which amounts to 150,000, 1.5 lakh, 1.5 lakh sub-centers and PHCs, will be converted into health and wellness centers. Now, this means that we have taken the decision that at the age of 30, every individual citizen of this country will be screened for hypertension, for diabetes, for tuberculosis, for leprosy, for dental care, for mental care, screening for oral cancer, screening for ladies for cervix cancer and breast cancer at the age of 30. And this year we have converted out of 1,50,000, 2,500 are functional. This year we are going to make it 15,000 functional. And next year we are going to make 40,000 functional. And each year we are going to increase. And by 2022, all health and wellness centers, 1.5 lakh, will be converted into health and wellness centers. And we will go for a universal screening. The impact is going to come when you screen a person at the age of 30 that you are hypertensive. We can reduce the burden of heart diseases. When we come to know that he is diabetic or he is a case which is very much close to the diabetes, we can treat him and see to it that we reduce the renal failures, the other complications which take place. So ultimately, the disease burden is going to come down, and this is called preventive and promotive healthcare. And we have introduced yoga also, and we want health and wellness. Wellness comes happiness. Happiness needs not only physical treatment. बीमारी को ठीक करने के साथ साथ बीमार को ठीक करना जरूरी है, उसके मानसिक अवस्था को ठीक करना जरूरी है. So this is how we are working on the preventive part. Now on the curative part, we were astonished to see the statistics. Higher strata of the society, disease burden 20 to 30%, hospitalization 80%. Lower strata of the society, disease burden 70 to 80%, hospitalization 20 to 30%. That means that the needed person was not getting the facility. The deprived class was not getting the facility. और वो भगवान के भरोसे अब मेरे heart problem हो गई है, I need a bypass to be done. It needs so much money, I don't have, so I live with medicines. And जितने दिन चल गया, चल गया. So they were not hospitalized. Here our Prime Minister took a very bold decision, and it is now the world's largest health coverage program, Modi Care, which is known as PMJ, Pradhan Mantri Jan Arogya Yojana. And in this PMJ, we decided that the marginal section of the society, the deprived class, and you see who are those people working in homes as home servant, rag pickers, rickshaw wala, thela wala, redi wala, mason, irregular contract worker. All these have been taken into this. And there are 10 crore 74 lakh families, which amounts to 50 to 55 crore people, more than 500 million people. And we are giving them a coverage of 5 lakh rupees per year per family. And the success of this program can be gauged by just in 100 days. More than 7 lakh people have taken the benefit of it, and major surgeries have taken place, major surgical interventions have taken place, and a bill has been raised to tune of more than 900 crores in just 100 days. And they are all deprived people. They are all deprived people, marginal section of the society. And they are getting their treatment done in private hospitals also. 16,000 impaneled hospitals have come up. Private hospitals as well as public hospitals. I can show you the videos which says that we could have never thought of going for these surgical interventions. It is because of this government, Modi ji's government, that we are getting this facility. And now, in 10 days, I am all right. I got my bypass done. I got my angioplasty done, and other interventions, whatever is needed, is being given. So this is, and it's the world's largest program. Nobody can imagine. And it is paperless, cashless, and portable. For example, a person from Jharkhand goes to Tata Memorial in Mumbai and gets an intervention done. So the money will be paid straight to Tata Memorial. If he goes to Vellore, it will be paid straight to Vellore. And it is paperless, it is cashless. More than 7 crore letters have gone to the beneficiaries. 7 lakh patients have been treated. More than 900 crores bill has been raised, which has been paid. And this is PMJ Modi Care, which we are trying to do. So this is how the preventive and the promotive healthcare has been taken care. The another major step which we took was trying to see, because you see, a child is a healthy child that has to be treated only in the first 2 years. Whatever the development has to take place of the child, it is decided in first 2 years. So what we did, we started Mission Indradhanush. The annual rate of increase of immunization was 1%. We took more than 360 districts which were vulnerable, which were not up to the mark, and we started our program called as Mission Indradhanush. And in Mission Indradhanush, what we did was that we tried to find out who are the left outs, who are vulnerable, who do not come into the ambit. They are labor workers, contract workers, they are with the contractors, they come, they work at a particular place, and then they leave. And when they leave, there is no record of them. And when there is no record of them, it becomes difficult to catch hold of them. We found out these left outs in 360 districts, and we started working on them. You'll be happy to note that the immunization increased from 60% to 70%. Our Prime Minister was not happy. He said, "No, it has to be reached 90. We have to go." He himself, we again came out with the left out districts, they were 190. And he started from Vadodara a program called as Intensified Mission Indradhanush. And in that Intensified Mission Indradhanush, we started it. And now the state-wise increase was 17%, 18%, 15%. And now we are plus 75. Prime Minister says by the end, you should reach 90%, and we are working on it. So that is, and immunization means we also increased. You see, this country, in this country, people used to get hospitalized, children used to get hospitalized for diarrhea, and the number was 13 lakh, 14 lakh, 1 lakh used to die. We increased the immunization, and we included rotavirus. We included measles, rubella. We included pneumococcal for pneumonia. We included IPV, and we also included state-specific Japanese encephalitis. So we also increased our immunization, number of immunization, and we also saw to it that the immunization itself should increase. So this is how we did about the immunization, which is known as the Indradhanush program, and it is being appreciated by all the health experts that yes, it has brought a difference. Nobody, it was not known to the public that the first half an hour the child should get the mother's milk. So we started a program called as MA, Mother's Absolute Affection. And in that we decided that the child should get for 6 months only the mother's milk, And in the first half an hour, it should be given to the child. So this is how we are trying to develop the immunization of the child, and trying to strengthen his immune system, or the child's immune system. So this is how we are working, and we started this program. Then our Prime Minister said that there are gynecologists, experts, and their facilities, their services should be taken. We started a program which is called as PMSMA, Pradhan Mantri Matritva Suraksha Abhiyan. More than 6,000 gynecologists joined us as volunteers. These gynecologists on every 9th of the month come to the public facility, and they do free antenatal checkups. And the number when you will hear, it is 1,6.9 lakh children has been free of cost. The gynecologists have done antenatal checkups. And 8 lakh high-risk patients have been identified, treated, and given the best type of facilities which can be there. This was the call of Pradhan Mantri, that the gynecologists should come forward, and on 9th of every month they are coming. More than 1,69 lakh antenatal checkups have been done. 8 lakh high-risk patients have been identified and taken care. Then our Prime Minister was disturbed about poor people having renal failures, going for dialysis, and every week going for 1 dialysis or 2 dialysis, and 1 dialysis used to mean at least 5,000, because 1 or 2,000 transportation and then paying there. So he took a very bold decision, and that was Pradhan Mantri Dialysis Yojana. Till date, 400 districts have been covered. It is a PPP model. We give them our facility. We give them water. We give them other facilities, electricity. We give them the space. The machine is installed by the private party. They provide the doctors. We have got some 3,336 dialysis machines. And you will be happy to know that free of cost till date, 2.6 lakh dialysis patients have been attended, and more than 30 lakh sessions have been done free of cost. Now you can imagine a poor person, he goes to a district hospital, gets his dialysis done bi-weekly, twice a week, free of cost. Approximately more than 900 crores we are spending on this per year. But you can understand how a common man has been benefited. So Pradhan Mantri Matritva Suraksha Abhiyan, Pradhan Mantri Dialysis Yojana, we started a program called as Amrit. Now Amrit is affordable medicine and reliable implant treatment. We realize that the rates of the medicines are too high, especially for cancer, especially for cardiovascular disease, especially for other diseases. We started this Amrit program. We have got now 145 outlets. We have, and it is all digital. We get a digital result. More than 1.4 lakh patients have been attended till date. More than 1,000 crore worth medicine has been dispersed, and it has been given in 472 crores. More than 500 crores has been the savings to the patient, because the reduction from MRP is 60 to 90%. A cancer medicine which you are getting for 1 lakh, in Amrit you are getting for 10,000. So this is how we have tried to intervene. We reduced the cost of stents. For knee replacement also, we did the intervention. We increased the number of the national list of essential medicines. So these are the interventions which we have taken, which we have done. And we increased for population control. We started a program called as Parivar Vikas Mission. I would like to share with you, because sometimes people become very pessimistic and they have a very negative picture about the population growth and things like that. There's a positive side of it also. You will be happy to note that the TFR, total fertility rate, should be 2.1. And more than 24 states have taken this total fertility rate at 2.1. Now it is only 7 states left, and we have demarcated them. And out of these 7 states, there are 147 districts which need a micro planning for population control and stabilization of population. So we increase the basket of contraceptives also. We introduce new strategies, and it is a micro strategy. For each district, there's a different strategy which we have developed. And we feel that in coming times, we will be able to address this 147 districts. And when we address these 147 districts, we'll be able to go forward. Then we also saw, when we did the mapping, we found that the health facilities in the west and in the south is better. But the central India, the eastern India, and the northern India is little behind, and it has to be addressed. So what we did, we started All India Institute of Medical Sciences in Bhopal, central India. We started All India Institute of Medical Sciences in Raipur, central India. We started All India Institute of Medical Sciences in Bhubaneswar, eastern central India. We started an All India Institute of Medical Sciences in Calcutta, eastern India. We started All India Institute of Medical Sciences in Assam. We started a program called for All India Institute of Medical Sciences in the northern side. And in the northern side, it was Jammu Kashmir, it was Srinagar, it was Jammu Kashmir, it was Himachal Pradesh, Bilaspur, it was Bhatinda in the north, and Jodhpur. So this is how we tried to give them the best curative healthcare, tertiary healthcare, and this is how we are going forward. Now, if you see the leap, in 60s, we started All India Institute of Medical Sciences known as New Delhi. It was in Vajpayee's government that we came out with new 6 All India Institute of Medical Sciences. And now we have got plus 13 in Modi's regime. The 13 All India Institute of Medical Sciences are coming up. And they are all state of art, where expenditure is no less than 1,000 plus crores only for making of that institutions. And this is the commitment for healthcare which we have done. So if you see in totality that health has taken a big leap. See, when I became the World Health Assembly President in Geneva for World Health Organization, India was considered to be one of the countries among many. But now, today, it is the Director General of World Health Organization says, Nadda, speak about Ayushman Bharat. People should replicate. The other countries should follow India now. Now, tuberculosis program, Prime Minister said that in 2030, I will share with you, the MMR, maternal mortality ratio, is to be reduced and brought within the limits in 2030. India is going to do that in 2023. And we are going that fast. Under 5 mortality, infant mortality rate, we are going as faster than the world pace. So when we go on the world platform, tuberculosis, they say, how you are doing it? Prime Minister Modi said that you have to eliminate tuberculosis by 2025, not wait for 2030. We rescheduled our program. We re-strategized our program. We came out with a national strategic elimination program of tuberculosis. Within a period of 4 years, we have purchased 400 CBNAT machines. And now, in total, we have got 1,000 CBNAT machines. Practically every district has got a CBNAT machine, which tells us about the tuberculosis. And we are able to, and we are going to go to the subdivisional level, where we have started an indigenous TrueNAT machine. With the CBNAT machine, we have got the TrueNAT machine also. And we are going for active screening. We are paying for the patient 500 rupees per month for his nutritional support. And private sector, if doctor detects there, he has to get it registered with us. The medicines we will give, the treatment he can do, but we will give the medicine and the nutritional support to the tuberculosis patient. So many interventions have been done. Daily regime has been introduced. Bedaquiline has been introduced. So whatever, we started the national hepatitis viral control program. Now we are taking hepatitis A, B, C, all together. It's one of the Whatever do becomes the world's largest program. And we have taken that program also, world's largest hepatitis viral control program. So many initiatives have been taken in healthcare, and I feel because, as I said, without the support and without the direction of Honorable Prime Minister, we could not have done it. It is because of him, the support which is being given to health. When I joined, there used to be slash in the budget. And there used to be an issue, a controversy. You were given 30,000 crores, now you have got only 24,000 crores, 6 crores have been slashed, you got 40,000 crores, 10 crores have gone, it has been slashed. Now we say, you tell the program, and the program will be implemented, budget is no problem, we will get it and we get it. Now 900 crores have been spent in just 100 days for Ayushman Bharat. And we are not satisfied. We say that 1,000 crores per month hona chahiye. That is the budget, that is the estimates which we expect. And of course, in coming times, because you see, the program has been rolled out and we are trying to stabilize it. It needs stabilization because it is paperless, it is cashless, it is all digital. Now, if you talk about the digital part of it, it is again a matter of study, of research, how we have done within a period of 5 months that we have connected 55 crore people digitally, and each one has got a separate QR card. And with his thumb, you don't need any card. It is your thumb which is going to work, and you are going to get the benefit of 5 lakh rupees per year per family. So this is how we have tried to go forward. I've talked about health, but health is one component. Under Prime Minister Modi's leadership, many things have happened. In America, in Europe, and other parts of the world, social security is an issue. But here, in 4 years, 60 crore people have come under the cover of social security. Jan Dhan Yojana, Pradhan Mantri Jeevan Suraksha Yojana, Pradhan Mantri Jeevan Bima Yojana, Mudra Yojana, Atal Pension Yojana. In total, it is 60 crore people who have come under the social security. So this is a matter of study, research, how Modi government has done in 4 years. You see, 18,000 villages did not have electricity. Now we have got electricity. I don't, figures may be corrected, but more than, I'm told, 6 crore people, household families have been connected with electricity. Aap dekhiye, who were not connected with electricity? Marginal section of the society, the deprived class. Now how, you see, ease of doing business, we talk about ease of doing things. Here we have got a case of ease of living. How the life has become easier. How the life has been taken care by the government. This is an example which we can do. Ujjwala Yojana, 8 crore people getting the gas connection. I am the direct beneficiary because you will see what happens. Whenever there is a problem in environment, in other things, we are the residue part. The patient lands in our hospital. Now, 8 crore families were burning that fossil fuel for their cooking. And now they have got a gas connection. Daily they were inhaling worth 20 to 30 cigarettes a day, those ladies. You could have understand their lungs situation, their coronary obstructive pulmonary disease, how it must be acting on them. But now they have been relieved. And this is how we are going to reduce the disease burden. When 8 crore families come out with a gas connection, that means that the lungs issue has been addressed properly, and it is directly related to health. So there are many interventions which has taken place and which has brought change in the life of the people, and especially the marginal section of the society, the deprived class who never had. Now this, even in Ayushman Bharat, previously it used to be enrolled basis. Enrollment means you go and get yourself enrolled. Now it is entitled based. You may go, you may not go, you are entitled for it. All socio-economic caste census data, he can go to any CSC, he can go to any hospital, get himself checked and see that whether he comes in Ayushman Bharat or not, and he will be given that facility. So friends, we have tried, in medical education, we have increased the seats In undergraduate, it has been increased more than 10,000, more than 18,000. In post-graduation, it has been increased more than 10,000. We are trying to bring a balance between the quality and quantity. India needs doctors. We are coming out with a new medical bill, and that medical bill wants to address comprehensively the medical education. NEET has been implemented, National Eligibility Entrance Test, and the results of NEET is that people from poor families are now becoming doctors. People from humble background are becoming doctors. And this is the change which has taken place because of National Entrance Eligibility Test. And you will be happy to know that private hospitals also, the admissions are not done by those medical colleges. It is centrally counselled by Government of India, Ministry of Health and Family Welfare. We give them the NEET list that these are the candidates. You can have your management quota. That is yours. But the government seats are going to be decided by us. And that is how in private colleges also, people from humble background are studying and having the medical education. So friends, we have tried to bring change, and the strength we derive from our Prime Minister. We work whatever best we can do. In a short span of time, we have tried to bring a change. And I feel that health, whenever I talk about health, health gives results. It takes time. You see, हमारे यहाँ जो NFHS का भी आता है, तो it comes 2013, 2014, 2016, because it takes time to calculate what impact it has made. But yes, in malaria, 2 days back, a report came, World Malaria Report. The morbidity has reduced to 54% and the mortality has reduced to 64%. A lot of interventions have been done in malaria also. So friends, once again, you gave me the opportunity to come and join your Festival of Bharat, and yes, Bharat is taking a lead, a big leap. Internationally, we are being recognized that way. In pharmacy, when I go on an international platform, the whole Africa says, we are saved because of Indian pharmaceutical industries, which has given us affordable and quality medicine, and that is why we exist. This is the certificate they give, it's not me. And our pharmaceutical leaders have done a tremendous job, which should be appreciated. So I find that there is a change, and we are all set to go forward in this direction. And India, if I talk about ODF, from 32% to 97%, now we are the saviors of the earth. The Prime Minister gets the award of Saviors of Earth. At one point of time, we were ridiculed and we were charged that we are the country which is creating pollution and which is contributing in not coming out with environmental issues, not addressing the environmental issues. And today, we are a country which gets the award. And our ODF has increased from 36 to 32 to 97%. So this talks about the change. Once again, thank you very much for giving me a very patient hearing.